If you're thinking about seeing a fertility specialist, this video is going to talk about what to expect from your first consultation, to testing, to treatment, and hopefully to that first pregnancy test, as well as through your first trimester of pregnancy. And I'm also going to answer one of the biggest questions that I get. Do I need so many ultrasounds, office visits, and blood tests? Hi, I'm Dr. Sharon Moayeri, owner and founder of OC Fertility. Let's first talk about the consultation. That's step one. During your consultation, it's helpful if you've had any testing or any treatments in the past to share those results with us ahead of time to give time for your provider to review those. In addition, you're going to need to provide history, so it's useful to make sure that you know any surgeries, any medications, any allergies you may have. We also want to know details about your menstrual cycles, any prior pregnancies, and outcomes of those pregnancies. The other things we're going to want to know about is if you have a partner, we need to know details about your partner and any testing your partner may have had. Sometimes when you're requesting records, you have to make sure that your partner also signs a medical release. They won't always be released with your medical records, which is something people don't always realize. The other thing that you'll get asked is questions about your lifestyle, and so these are things that we're not trying to make judgments about, but we need to know in terms of treatment decisions. Once you're done with your consultation, you'll be given a checklist, or what we call a to-do list. We like to break it down in an acronym: PS HUGS. P is for prenatal lab testing, S is for STD panel, H is for hormone testing, U is for uterine cavity and fallopian tube evaluation, G is for genetic screening, and the second S is for sperm testing. We'll give you instructions and orders so that you can get those tests done. Typically, it takes about a month to complete everything and get the results back. Once you've completed your testing, you can move on to the next phase, and that will be regrouping with your provider to go over the results and come up with a treatment plan. Depending on what the results show, you'll be given options. Sometimes it's pretty clear cut. If there's something that needs to be fixed or corrected, that'll be the first step. Otherwise, you'll kind of go through the pros and cons of the different treatment options and make a decision about what you want to do next. Next, we're going to talk about treatment. Really, it depends on, again, what your results show. Sometimes people already come to us having received treatment elsewhere. Those patients might be jumping into treatment a little quicker than what we've outlined. Most patients, though, need about a month for testing and regrouping for results before they go into treatment. Occasionally, we will have patients who start treatment sooner than that, or some who might take longer because of whatever the test results show, or however long it takes them to organize doing their tests. So treatment might involve what I mentioned before, fixing whatever needs to be fixed. So if you've got, for instance, polyps, we might do what's called a hysteroscopy to remove the polyps. Otherwise, we might be talking about things that enhance fertility. So medications like Clomid or Letrozole, or gonadotropins, which are injections that help ovulate more than one egg a month. Intrauterine insemination, where we take the sperm of either a partner or a sperm donor and place it inside the uterine cavity to help shorten the distance the sperm needs to travel for pregnancy. In vitro fertilization is another treatment option where we actually remove the eggs from a woman's ovaries and combine them with sperm in the laboratory. We can also do genetic testing on the embryos. That's called pre-implantation genetic testing. If there's a malfactor, sometimes sperm needs to be extracted directly from the testes. Also, we do some techniques in the laboratory to assist with malfactors, such as intracytoplasmic sperm injection, or what's abbreviated as ICSI. In terms of timing for treatment, most of our treatments use your menstrual cycle to start treatment. For patients who don't have menstrual cycles or who don't have normal menstrual cycles, we have a lot of other ways to get you to start treatment, so don't be worried about that. So one of the things I often get asked when patients are in treatment, especially if they're doing treatments like in vitro fertilization or intrauterine insemination, is why do I need so many office visits, ultrasounds, and blood tests? We do this, one, to protect you because we want to make sure that we're not giving you too much medicine. We also want to make sure that if your treatment can be better than what we started with, that we're adjusting the medications. Maybe we need to go up on the medications than what we expected you might need. We also want to time things correctly. Not every person responds at the same pace or with the same degree of responsiveness. So seeing you frequently, checking your hormone levels, and doing pelvic ultrasounds enables us to really gather information that's important for your treatment. Last thing I want to talk about is kind of give you a big picture overview of what a typical cycle looks like. For in vitro, we usually want to see you somewhere between day 1 and 3 of your menstrual cycle. For my patients, I always like them to plan ahead. So if possible, if your cycles are normal, I like you to anticipate when your period's going to start. Go ahead and book your baseline appointment. That way you can work your schedule around it. You're not scrambling the day of your period, panicking. And you have a target to get your medical consent forms done, to get your medications ordered. If there's any insurance, you can get your prior authorizations done. And so you can really plan your life around that. If your period doesn't start when expected, then you can always reroute that appointment, but at least you have something planned ahead of time. If everything looks good to start, you'll be doing potentially medications that are injectables or pills, oftentimes both, and then we'll be seeing you frequently. Typically, we'll see you in another 3 to 5 days, again, depending on how your ovaries respond to the medication. Once you've done insemination, we wait about 2 weeks to find out if you're pregnant. If you've done an egg retrieval, it depends on if you're doing a fresh embryo transfer or a frozen embryo transfer. Increasingly, we do frozen embryo transfers. So after the egg retrieval, the embryos will grow in the lab for about a week. They get to the stage called the blastocyst embryo. At that point, if you're going to do genetic testing, before you freeze the embryo, you would remove a few cells of each embryo and then send those cells off for genetic testing. The embryos stay at the laboratory. The genetic testing can look at things like the number of chromosomes, and we call that aneuploid testing or pre-implantation genetic testing for aneuploidy. It can also look for single gene disorders like cystic fibrosis, and we call that pre-implantation genetic testing for mutations. It takes about 2 to 3 weeks to get those results back. In the meantime, the embryos are frozen and you're home recovering. From the time of your egg retrieval to your next period is typically 10 to 14 days. If you wanted to start prepping for your embryo transfer, you could do that as soon as your next period, or you could wait until you get the results back from your genetic testing of the embryos to make a decision about what you want to do next. And then if you decide to move on with an embryo transfer, there's very many different kinds of protocols. There's natural cycle embryo transfers, in which case we would track your natural ovulation and place the embryo back roughly 3 weeks from when you started your period, which is about a week out from ovulation. If you do a medicated cycle, again, there's different protocols, but typically somewhere between 3 to 7 weeks of prep. Once the embryo goes back in the uterus, we usually wait about 9 to 10 days to do a pregnancy test. The actual embryo transfer procedure itself is done awake typically. And again, it's very similar to an intrauterine insemination procedure. A small medical tube called a catheter is passed through the cervix and the embryo is placed inside the uterine cavity. We usually use an ultrasound to do so. In our practice, we use transvaginal ultrasound. Some practices use transabdominal ultrasound. If you're considering fertility treatment, that's what you can expect for your journey. And if you want a personalized plan, please book an appointment. I'd love to make videos answering your specific questions. So if you have one, please leave a comment below.